Medieval is best.
All right, so that is my official we beginning. Welcome, guys. This is podcast number 33. I don't know because this is my fourth podcast for the week, so I'm getting a little bit confused with where I'm at. But today's podcast is with a trauma surgeon, Denis Allard from Luxembourg, who is a trauma surgeon at Barnard Hospital. And Denny's been in the country almost longer than me. Not really.
You were born here?
No, I'm born here. So Denny came here in 1998, studying to be a doctor. And then there's not enough trauma happening in Luxembourg.
There was a lot of trauma happening here.
Okay, and more trauma happening here. So this is a great place to learn. And it's been 22 years basically now.
21 years that I'm here. Worked in the public service. Went up and worked in Joburg, went in an African country, and now private trauma surgery. Different aspects of wounded people, absolutely.
So I'm gonna have a chat to Denny. We've got a little bit of a idea. So some of the topics that came up was my first question is going to be, what's the link between money and survival? And but some of the other ideas is how South Africa is trying to establish the best trauma system for all.
Yeah.
State of violence in South Africa, accidents and their consequences on life. How can bad accidents maybe bring a change of view on your life? Meditation and the benefits thereof. Changes in the world today. How we are the best and the worst. Living consciously, and a few things, you know. So I would also like to get your opinion on maybe the NHS
project.
Yeah, private medical care, how good they are, pros and cons, because we all have an opinion, but we don't always understand maybe.
Yeah.
So getting an informed opinion from someone. Also, just getting an opinion on how good are we doing in South Africa when it comes to medical care, or specifically trauma. So yeah, and just before we continue, if you are watching this on YouTube, please press like or subscribe to the channel. If you like anything or you don't like anything in the video, please comment and let me know. It's just always cool to get people's interaction. This is a hobby for me right now, so it's just nice to see that people are actually listening. If you're an audio listener, drop us an email at talkingorangutan@gmail.com if you guys have any comments that you want to give me. But anyway, let's jump in.
You say talking orangutan, but it has an S. So, Orangutans.
Yeah, so
with an S.
It's Talking Orangutans podcast, but the email is Talking Orangutan.
Okay.
Singular.
Okay, good.
So
important detail.
It just also, if there is any spam and stuff going on, they can't just copy and paste the name of the podcast. They actually have to eliminate the S. Then I know that the emails that are actually coming through, they're really meant for me.
I know it because when I searched the podcast, it didn't. I needed to go into the detail of the spelling.
Yeah.
To get it.
It's going to get some traction this coming year with all the podcasts coming out. So, is there a link between people that have money and surviving, and where is that exactly?
Between money and surviving, yes. Even already between how we live our lives and what level of education we have. I mean, it is clear living a better life, a more informed life, having gone to school, knowing basics, then one will already try to avoid the dependencies on alcohol, the driving unconsciously, the driving under influence, the walking. So safe behavior. Safe behavior is important. I remember in the days in the 70s we would learn how to the rules of the road in Luxembourg by going to these gardens. I know it happened here as well. Going to a little Verkehrsgarten, is a German word. What would it be in English? A little, learning how to drive safely, safe behavior is being taught. And when children know that, crossing the road, all these basics, and then there's still accidents, and accidents will happen. People fall off mountains. Firefighters get electrocuted because they're busy extinguishing a Feldfire, and there's an Eskom line, wire lying free, and a couple of people get electrocuted. Burn happen. So when one is socioeconomically poorer, one will of course be more afflicted by trauma. When one lives in our country here, when one lives in the Cape Flats, of course, one is more at risk for stray bullets. Unfortunately, when one doesn't behave carefully, one gets stabbed easily. But one can get stabbed walking home from the waterfront. All that. So, survival, well, if your body is... And trauma happens usually to young people. So if one is healthier, fitter, and one has the chance of getting to the right place in the right time, then the chances are best. And we are a country with islands of excellence in a big sea of mediocrity, like we like to say. Could it be islands of wealth in a big sea of poverty or relative poverty? Because we're not anymore, we're still a developing country. So do wealthy people get better care? Private health care is fantastic, yes, but you pay a medical aid every month. So you have the economical means to do that. And then you get top care, really top care. Public hospital also, sometimes top care. Go to Ski Hospital, Tigerberg Hospital, but they're overwhelmed, easily overwhelmed. Every weekend, easily overwhelmed. And then sometimes the poor prognosis people are not being taken. There's triage then all the time. Triage means taking the one who is the biggest threat to life and the highest chance of survival first. So yes, there is an economical reality to saving lives. Life has no price, but saving a life comes at a cost. And that is a cost that the society carries. And so, so that is the reality.
It is what it is.
It is what it is. We should all aspire to creating a system where everybody gets what he or she needs.
Is there a country that you know of that you like their approach to the medical system with public health care? The way they practice giving the same type of healthcare to all, that is on a fairly high level, that you know you'll be able to assist anyone coming through the door.
Where I come from, where I was born, Luxembourg, really situated really in the top of the diagram of wealth and longevity. So people are individually quite wealthy and live long, and people get hip replacements when they need it. They get cataract replacement, cataract surgery when they need it. It is a socialized medicine where you can add to a private insurance, but you will get excellent care. Now, in a country like that, there's still people that you see the thing is with medicine, and I, having studied in Belgium, where the university was in Brussels, and then coming to South Africa, I realized, and I looked a little bit into it, the systems do adapt to what the need is in that country. That's why in this country, doctors are very good, because they deal with a lot of advanced pathology in a lot of people. A lot of the poor people came with advanced tumors, with the high amount of trauma. Doctors did a lot. So that is why that system here is a system, and we have a system here where we can't, where economically 80% of the people rely on a government-funded system. 20%, it's 16%, in fact, 84 and 16%, but say roughly 80-20. 20% rely on private insurance. In Luxembourg, for example, 100% of the people are insured. They contribute in one way or another. The pensioners are being contributed for. The children belong to parents that contributed in one way. So, or in the Scandinavian countries. So, but then in those countries, the advanced diseases are rare. So if you come with a rare disease, an advanced disease, your chances for finding experts in that field is also rare. Diseases in the world, yes, rare, a little bit everywhere. Rare diseases need to get to the right place. Rare diseases develop more slowly, so it's. But once you find it, you need to have the luck to be referred to the right place, and that is usually a university hospital, provincial hospital. You wouldn't find the expert of the adrenal gland or so. So, is there a country in the world where there's a great system?
Sorry, I'm going to interrupt you there for a second, because I assume that Luxembourg, the population is not that high.
600,000.
So it's also, is there a country with a population of 40 million plus that has a really good medical system?
In Europe, there is a couple of systems that are good. The Dutch system is good, Dutch system as well, and then from a trauma perspective. So there's yes, it's so the system. One must look at how much of the GDP is spent in healthcare cost. And these are numbers that usually vary from 7 to 12%. I'm not the expert in it, but roughly, I think we spend, I wouldn't say a number now, but we spend a relatively high amount on healthcare, yes. The same than Belgium, for example. South Africa spends the same amount than Belgium. And so one needs always to get the best outcome for the money. I mean, we hear from America that it is a big challenge. And it is always a big challenge because the money that one spends on, it's a grudge expense. When you
hesitantly
spending money on healthcare or on health insurance, if you when you're young, you don't really think you need it, and that's you understand that you need it. And when you then have it and you need it and you get good paid care, that's fantastic. But it's a grudge expense. So and in any system, it's always about trying to spend what we have on the most needy. The thing is, we will spend the most on people in their last months of life. Like in America as well. One will often say America because all these studies, the big numbers always come from there.
Yeah.
And in America, we know close to 80% is being spent on people in their last months of life. Unfortunately, one doesn't know when is the last months of life. You see.
Yeah, I was in America in September for my chiropractic / nutrition / body do-over. Mm-hmm. And the belief from the doctor I went to there, Dr. Seth Strauss and Dr. Katali Strauss, at the Posture and Spine in Charleston, South Carolina, is that everyone pays a lot of money to be healthy. You can decide if you're going to spend gradually over your lifetime, or do you want to spend all the money in the last 5 to 15 years? Because certain body parts or the spine specifically degenerates quite a lot towards the end, and then it takes a lot of money and a lot of intensive care to look after it, where if you maybe did it more gradually over a lifetime, it's better, you know.
We should spend money on preventing illnesses from happening.
Yes.
And that's where we need collectively to fight obesity. We need to educate children in healthy eating, in being active. So the acronym DAVID, diet, activity, being active every day, vital signs monitoring. Yes, if we have a system where people get sugar checks and blood pressure measurements and intervention, reducing weight, losing weight so that the diabetes can even regress, or early treatments. And then I for inner body awareness. Yes, if we yoga or meditation or more and more, even schools realize that spending time learning, teaching children how to use relaxation instead of using tablets. And also then, and then D for devotion. So for a good life, with diet, activity, vital signs monitoring, inner body awareness, and devotion being for trying to make the world a better place. So if we live like that, that is preventative, because then we're going to have a good life, and we're not going to suffer too much. But then there will still be we are all predisposed to certain illnesses. That is true. Genetically, probably yes. Now, we don't fully understand that. Again, I'm not the expert in that, but just as a doctor, I can say that we know that even two people with the same affliction and infection, some will respond just better than others. Why is the one body stronger, more resistant, develops infection? Why is the immune system giving you an allergy and your twin brother does not have an allergy?
Yeah.
That's why the twin model is a very interesting model.
The twin model?
Yeah, in twins. In twins, examining why twins would not both develop the same disease, and then especially examining twins that were brought up in different environments.
Did you see the documentary with the triplets?
I did. How was that?
I haven't seen it, but I've talked about it a few times. So
3 identical strangers.
So are you glad that there's a documentary like that?
The way it was done is, of course, ethically wrong. You don't separate triplets at birth. They were given up for adoption. You don't start separating them at birth. You place them into 3 different socioeconomic level families: the blue-collar worker, the working family, the blue-collar worker, and the high-level professional. And then you go and you study them one day a year, how they develop. I mean, and it was done, obviously. That's why the movie exists. That's why these three young men that were triplets found each other. It happened in the beginning 80s in America, and now we know that somewhere in a big university there's locked up a study where all these these identical twins or triplets were studied at that level by an Austrian, originally psychiatrist, a psychiatrist from Austria. So that is questionable, of course.
But very insightful with the understanding the human body and mind.
Yeah.
I feel a bit like, and correct me if I'm wrong, but from what I've been told or from what I've read is that in the Second World War, a lot of experiments were done on humans. But then that, although very wrong, that contributed massively towards understanding the human body. Is that correct? I am not informed more. I know
Nazi Germany did experiments on children, but no, they were to inject humans with toxins and then seeing them die. That's not what contributed. Not at all. I mean, the biggest discoveries have been done in the wars, in the war times, and especially with trauma. So understanding what happens now if we can do an animal model, and we use a lot of animal models, making animals lose blood and then seeing how far, and then we describe shock and we find ways of stopping the bleeding and so on. So that is still, so that's what we humans do. We try to help ourselves by using animal models, and we need to become a little bit kinder, because we're not terribly kind to our animals. So we need to, when we do these things, it really should be done in a way of not making people or beings, sentient beings, suffer.
But how do you find out if this is working if you can't test it? If you couldn't use animals, then what is the alternative to find out if it works or not?
Yeah, correct.
Testing it in a trauma facility, and it's like, I can give you this type of treatment. We don't know if it's going to work because we've never tested it on anything that's living. So up to the family to decide if they want to do it.
Testing it on living, yes, and that's how medication is being first tested on. I mean, this is, I'm not a pharmacologist, but yes, we do test first. If a substance causes harm. So there is always a couple of humans that will swallow a tablet, and we will see if it does yes or no cause an effect in the body. And then once the safety has been established, then one looks at if it induces, if it can help. So developing new drugs happens all over the world, and yes, it happens in animal models. That is true, because there's animals that are close to how we function. But it's if we wouldn't have we live as if we were the most important animal on the planet, which we made it to the top of the food chain, but apparently we made it there, but we are still relatively unsecure and full of fears. Apparently, like the shark in its domain of the fish world has made it to the top, and is much more stays at the top, and is much more well positioned in his position than we humans, with we're still not very good.
Always looking over our shoulders. Where's the next threat coming from?
And we are our biggest threat. And it's through how we behave towards each other and how we behave towards ourselves.
So but I just have a million questions that I want to ask you, and I don't want to jump.
No.
Our mutual friend Jakub,
yes,
he told me, like, you always jump between all the topics so quickly, and maybe spend some more time just discussing one. So I'm very careful since then, but
yes.
So where's the link between mental health and surviving physical health? Because I'm sure you have some people that you have to work on, and it's like maybe mentally they're not strong enough to survive or to overcome the challenges, and that has a massive impact on them degressing or going slightly backwards or stagnating or just not moving forward because the mental strength isn't there. And if it hasn't been there for 40 years and you live with all this stress on a daily basis, I'm sure it must have a massive negative impact on the whole ecosystem.
That one cannot measure. You cannot if a 35-year-old yes, can have, I would say a 35-year-old dependent on alcohol and drugs will, of course, after any accident where he lies now in an intensive care for a couple of days, we will treat his dependency. We can replace, we will not make him drink, but we will give him Valium and so on, but it will be a setback, absolutely. How are we humans all the same? Of course, we are not all the same. We realized in high school that some of us were better in sports than others, and then later in life, quite soon, some are more resilient to waking up in an accident after a car accident than others. That is true, and that's also where then our personality comes out. But over first the physiology. So I'm not when the one patient said to me, "Doctor, I had an eating disorder." I said, "Don't you worry. We're gonna that for the moment isn't gonna matter. Your eating disorder." So, and that's where then in trauma and emergency surgery, it's first the basics, and the basic is airway, breathing, circulation.
Yeah. ABCs.
ABC, disability, and then environment exposure. So keeping the patient warm, assuring oxygen delivery, stopping bleeding, controlling contamination, and having a sequence of finding in the trauma patient where the injury lies, what needs to be done, even if we don't know the precise diagnosis, intervening, absolutely. So do we then have a different chance? Yes, absolutely. An easy, healthy 28-year-old will survive better than a 28-year-old with substance abuse, dependency, absolutely. But still, substance abuse can be overcome. You will you will have cold turkey a couple of days, but it's not that frequent, but it's also not rare. Yeah.
And then how much time do you spend with patients once you've finished with them in the emergency room?
As a trauma surgeon, until they leave to rehab or home, and then they come back to have sutures removed, or it was severe enough and they stayed the whole 7 to 3 weeks, 4 weeks. One patient stayed 3.5 months, big burns, 3.5 months inside hospital. I know of a burns patient, not in my center, who is in hospital for over a year now. Over a year. Burned 80% and had innumerable operations. Yeah. So that happens. And that's very, very costly, and that's very labor intensive. So we're going to get somebody to survive an 80% burns. And yes, and every time there's these ethical questions, should one not? And there is no, our biggest burn professor from Red Cross Children's Hospital gave us an excellent talk as well, where it's not at that moment on a single individual to decide.
Decide what?
Deciding to stop treating. So we're going to continue treating, but bringing family in. Of course, there's trauma or injuries that are not survivable. That is true. Sorry, if we went
please.
off.
I like it.
That is, so when to, and then comes the age as well. Huh? So if you are 85 and that brain injury is not survivable, we will not insist, of course, because these are limiting injuries where normal life cannot be expected.
So how it's just so many things that I want to ask. How do you learn to be okay with all of that? And how do you return to the normal world after seeing that over the weekend?
Or over several days or weeks.
Or several days or weeks. Like
Yeah. When last year over a 5-week period, 5 trauma deaths had happened, and we did everything. We tried to stop the bleeding, even in the front room. 3 died of gunshots. They were very, very far. Most had arrested. One had arrested even before arriving. So those incidences is difficult. And then I took a little bit leave and regathered. And trauma surgeon, you must be prepared. Any doctor, you must be prepared to encounter a diagnosis of terminal illness. That very, very quickly in medical studies, one realizes that that's what we do. Healing, maintaining life, but at what price? And then seeing sometimes that if that would have happened, the patient would have survived. Or if we would have had more blood, or
do you sit with those questions in your head when you go home?
Oh, over all these years, of course. Okay. There was often, yes. Often, and that's when we get together and we do a debriefing. That's when we gather in morbidity and mortality meetings, where we every month analyze, we discuss cases that didn't survive. Was everything done? Was it an avoidable death or unavoidable death? These are then, that gets kept for the record. Yeah, absolutely. So doctors must always do their best.
And if there are any other trauma surgeons listening, and they've had a bad period like you had for 4 months or weeks, what is your suggestion on what should you do during your holiday trying to gather yourself? What helps you to connect again and be like, okay, I'm ready to go back to work and I've let go of the trauma a little bit?
Sharing it with your work colleagues. Important having discussed the case, and then having different minds will have different views on it. And then in big, the trauma case that comes in and collapses and is busy dying, and you try to save him, and he's 20 and dies of a gunshot wound, is difficult, because there will be the emergency doctor helping you, and possibly an anesthetist if it comes to surgery, and that's it. So that's a limited team, and there, debriefing, good, and then so my way, I then talk about it, not just putting it back or pushing it back, analyzing it. And then the time will have helped you. I mean, you got there. Trauma surgery is a subspecialty of surgery. We are the first country in the world where we have that subspecialty since 2008. So South Africa, first in the world where trauma surgeons are a registered subspecialty of general surgery. And then since 2010, holding exams. Still, we are only 40 in the country, around 40 trauma surgeons for a population of 55 million. So many general surgeons do trauma, of course. But and we like to be sort of the leaders in the field, in teaching it, and in being then employed and sitting in those top-level trauma centers. Like when we say, the right patient to the right place in the right time, your chances are best if when you are polytrauma, when you're broken and bleeding and unconscious, that the system of the paramedics in South Africa know where the best place is to bring you.
Okay, So
that is like that. So
they're very good, the paramedics?
Oh, well, yes, our paramedics are world class, indeed. Yeah, they are world class because they have seen so much. And real difficulties, if one speaks of the paramedic problem, where ambulance paramedics are being attacked as well.
I heard a story the
Flats.
other day of paramedics having to go to the police station to wait for an escort, and then sometimes waiting an hour or 2 or 3 hours before an escort arrives to help them to go into certain areas.
It doesn't take that long, but it does make the response time, it prolongs the response time by 20 minutes currently.
On average.
Here in the Western Cape. Absolutely. We have these numbers by the responsible of the Western Cape who spoke to us at the last Trauma Congress. So to have to assure the safety of the ambulance people, to then require police escort, it's not normal. They are under a lot of stress. We have paramedics that where their families are not sure. Well, every time they go to work, they hope that they are going to come home. We had paramedics that were killed on the job, and that has always been. I mean, our gangsterism in Cape Town is beyond. It's not normal. It's not normal, and that's a situation. Drugs and culturally lost.
But what is there to gain to rob a paramedic van? The van itself, or
no, they don't rob the paramedic, but they attack the paramedics. If these are your enemies that you shot, if a paramedic comes and tries to save your life, you're gonna hold a weapon to his head and say, "You now leave here, otherwise you're also going to be dead." And these are the situations. And there were situations where paramedics had to leave and didn't. Yeah. And that is, I heard these stories from 25 years ago already. That is happening.
So saving one life, there's so many small little factors involved, and there's a variety of people involved.
Yeah.
But you're the one that gets a lot of the glory?
The whole system is no. It's never. It's not a one-man show. It is a system. We're all part of a system, and indeed the bug ends with the trauma surgeon to stop the bleeding, control contamination. But what I tell my patients is, once the operation was done or so, and depending on how complex their case, I say, well. If you were airlifted from Laingsburg to Cape Town after a motor vehicle accident, until you come to me and we have you in ICU, there were between 30 and around 50 people actually already involved on your first day. From everybody involved. The helicopter crew that flew to you, the paramedics on the ground, the people behind sitting in their control rooms, hospital staff, nursing staff, operating theater staff, ICU care. It's really what we do best. In those moments, you realize that we have brought it very, very far. Very, very far. We have a system where 50 people with a lot of know-how and coordination bring together the best to preserve life. So we do that all together. So that is fantastic. While other the factors were sometimes it's chance. Sometimes you overtake a car. I mean, the driving, but we will never stop driving. Let's admit it. We invented cars that will continue. We invented flying. We invented. We climb. We like to take risks.
This is one. This wasn't a trauma surgeon, but this was. I was in the emergency room because of cycling, and What surprised me, not surprised, it always surprises me. I've had a few visits
Yes.
to the emergency room, and it always surprises me how calm the people are in there, from nurses to the actual doctor. And sometimes they are frustratingly calm. But then I thought about it later. I'm like, I'm sure 5 seconds will not make a difference between survival and
sometimes
dying.
it does.
Yeah.
And those people in those situations didn't see that you were nervous. And no, sometimes, of course, we're nervous. Of course, we come sometimes running. But it depends. If you lie there and you shout loudest, you are probably not the most injured.
Yeah.
And the one that lies there very quietly and possibly stop breathing, that's the one that we're going to triage first.
I've never been in an extremely severe situation in there. I think the way I'm trying to relate this whole trauma is a couple of accidents that I had. But the biggest trauma experience I had was I finished work one night. I was working as a waiter in Stellenbosch. I drove home at 11:30 at night. I drove past my parents' house and I saw my dad's vehicle. The car was switched on, the lights was on, his door was open, and he came running out and he was locking the door. And I was like, and I stopped, I pulled in. I'm like, what's wrong? He's like, your brother's been stabbed. And I'm like, where is he? It's like, at the police station. So we both just jumped in, no talk. Let's just conserve our energy.
Yeah.
You talk what you can talk about. And my question was, how bad? He's like, I don't know. And we entered the Stellenbosch police station, and he was sitting there. And I have a 3-day
first aid
in London. So they teach you the ABCs. So I walk in, and it's probably a room very similar to this, maybe like 20 square meters, and it's just blood everywhere. And my brother's sitting there looking at me like this, and I'm just like, let's put just a little bit of pressure on the wound. And I was just in the police station, and there's no one applying first aid. And the towel that he had was a dirty towel that they got from the bathroom. And then my brother was a little bit drunk, because this was at 11:30 at night. So he's like, look at this. And he shows me, and there's like
a big gash.
So I'm like this. So we're like, where's the ambulance? No, the ambulance is taking their time. So we like throw him into the car. We race to the emergency room, and we arrive there. But then it's this frustrating part of, do you have medical insurance? Do you not? Do you have money? Do you not? And it's like, listen.
Yeah.
It's a very, and I feel for the secretary or whoever that person is, because they just following the rules. But I'm like, it's almost like I want to throw 10,000 rand cash into her face and just be like, listen, it's not a problem. You know, and then it's fascinating to see how you put the individual down. The trauma surgeon's like, okay, I was busy with this, but let me look at this, and then let me gauge this triage, what you were talking about. And then very calm. And I'm like, I don't know, that's my experience. And then you leave again and you wait outside, and it's like, what now? And then 15 minutes later, in this situation, 10 minutes later, he came out. He's like, listen, I'm about to clean everything. I'm about to fix it. But your brother would really like a picture of the wound before, before I start, so he can show all his friends. So we took a picture. And then about an hour later, he left with about 80 or 90 stitches.
That was good.
And everything was done very nicely. So the one part is all of that, but it does bother me mentally. The fact that people are willing to inflict that on another person for no reason. The fact that the police system does not work where they did not assist. The fact that when we opened the case, they did not really want to do anything about it. And the fact that is a reality if you walk home and not drive home. And a lot of that bothers me. And the fact that it's not the first incident where a family member has been stabbed. I have this thing of, I'm very grateful some nights when I go to bed and nothing's happened to any of my family members. I haven't had an emergency phone call where, listen, this has happened, because it's happened a few times. So the emotional and mental aspect of all of that, plus this incident was, we assume it's a gang initiation. It was 2 individuals, they just stopped the car, climbed out and started stabbing my brother with a knife. They didn't think he would fight back, and when he started, they got a... And then my brother just ran, and he was right next to the police station.
Yes.
So, he was basically going to die. So the fact that he's alive, it's a miracle.
Yes.
And those aspects bother me. It's like, are we really that primitive as a human species?
So there will be people listening from other countries, and me as an European, freshly immigrated 21 years ago into South Africa, yes, we do have a gang violence. You can see that. You can find it in different documentaries. Ross Kemp did very good documentaries on gangs in the world. South Africa, especially Cape Town. Here we're on the outskirts of Cape Town. We're in Stellenbosch. But a reality of young, lost souls that were brought up in broken families with no... They weren't really... I like to say that when your best chance in life is when your parents wanted you. And so often children just get born. There was an alcohol involved encounter, and the child was made, and that young girl continued to pregnancy, which is so wrong. And then can we blame these lost children for having been brought up by lost children? Gang reality, big harbor, lots of drugs. So yes, we do have very high gangsterism. It is a colored population phenomenon often. Again, for the non-South Africans, we speak of black and white, and we have the colored people. Our colored people, very, very few are born of mixed race. The Trevor Noah, born by a Swiss father, and of course our mother is not that is not the colored.
In America and I think England, colored is you will lose your job if you use that at work.
Here in South Africa,
it's almost an insult to some people if you say you're mixed race. You're like, dude, I'm not mixed race, I'm colored. Like
here we speak of colored people, and they were before not white enough, and now not black enough. Sometimes in the system, and the apartheid system, not wide enough. But our colored people are descendants from the Cape Malay, philosophically, there's a lot to say about who are we, who am I in my life. That is so important. And I'm always being asked, are you German? And I said, no, I'm not German. I'm a Luxembourger. Oh, I thought Luxembourg no, Luxembourg is not part of Germany. And we would be told still in the 70s, not me personally, but friends were told, don't you ever come home with a German girlfriend. So the Second World War, what the Germans did to the world, left a big mark, and the people hated them. And we must recognize that up to this day, the whole German culture, still, it was just now the 75th anniversary of the liberation of Auschwitz. All this was inflicted by a German nation, like the Japanese nation on the other side of Second World War, and how these cultures then worked hard and with a lot of discipline to again overcome all that. But they had been the bad people. So that's culturally. So so who are we really? And culturally, colored people in South Africa. Who am I? Who am I? Where do I come from? When I initially always asked my patients, so where do your ancestors come from? And then I often heard that my grandfather came from Italy, but colored people were never proud to be not white. So that was, and even today in the world, being a white male is, aren't we lucky to be white males? No, yes, Caucasian. You descend from, I mean, your hair is blonder than mine. You were born here on the African continent. I was born in the center of Europe. So we all come from somewhere. But at the end, in this world where we are all going to grow together and where we can communicate around the whole world and where we all speak with an accent. I mean, English is my fourth language that I only started strictly learning at the age of 11 in school. But we need to, on this planet, be able to function together. So where did we come here? Yeah, who we are, and then the identity crisis, and then violent behavior from being lost, and then did apartheid do a lot of bad things? Yes, it did. It did tell people that they were not good enough. And then today, yes, I know, argument, a lot of young people today, they never knew apartheid. So they were born afterwards, so they must just behave normally. No, they can't behave normally. They were born in broken families. Where do the broken families come from? And are we creating broken families? Are we divorce rate being very high? And then one can open the chapter on relationships, because that's it. Why in the world is there suffering? Well, a lot is induced by us, and it's induced by us because we never studied ourselves. We never did an honest introspection, and we never, most of us. So we need in life to say, okay, who am I really? Where do I come from? Even if I don't understand all that, but what are my real thoughts? And then what is my dark side? Hey, what is my dark side? So sometimes I'm lucky. I can hide behind a mask, get people undressed and use a knife and cut into them. I say that tongue in cheek, and I do that to help them. But if you think about it, the surgeons it is quite something to get to the point where you learn how to now do an operation, and it's quite an invasive act that we do. We do indeed at that moment consider you as a human body, and now I'm going to cut from the top to the bottom, open up and stop bleeding and control contamination. I learned how to do it, and yet I'm aware enough that it is quite an invasive act, indeed. Cutting into people, or you have a complete joint dislocation, and to reduce it, we put you out, but then we need to pull quite hard to get the joint back in place. So there is something physical sometimes in healing, and at that moment you need to not to shiver, like what you did with your brother. You compressed the bleeding. So if you have a bleeding, put a finger on it and press. Yeah.
So understanding the dark side.
Yeah. Let's go there.
Let's go there.
Understanding our dark sides.
I see we're at about 50, just over 50 minutes,
Wow.
and there's such a variety of topics. And
Yes.
how do you understand the dark side? So for you, like my wife's Polish, so I've come to understand that from visiting Poland, to understand my wife, I met her in London, and then we moved to South Africa together. And then after about 3 or 4 years, I moved to Warsaw. And only then did I really start to understand who is my wife and why is she behaving the way she is. And it's seeing the city, but it's also going to the museums.
Yes.
It's speaking to her father, her mother,
Yeah.
speaking to her grandmother. Her grandmother was in the Second World War. And then also I was lucky enough that I was an English teacher, and one of my students was a history teacher. I worked within an editorial company, and they were writing books, and he needed to practice his English, so he taught me the history of Poland. And then if you understand the history of the last 1,000 years of Poland, you also understand that there's this inherent survival within them. There's this small flame within their spirits that you'll never be able to break. And then I'm like, okay. If I have a small argument with my wife, there is something that's been shaped and formed and forged within her due to a history. And after that, I also started trying to understand my history, my grandmother, Is that how you get to understand? How do you get to understand your dark side and make peace with it?
Humans, we're being challenged because we all have an identity. In the past, my grandfather only had the people around him in the same village. His grandson now lives 10,000 kilometers away and meets people from completely different backgrounds. So it has become very rapid, this interaction of human beings. Human beings, our basics is survival, fight and flight response, very deeply ingrained against the wild animals initially, and then against each other. And that was since we developed possibly the human ego. Human ego, psychologically, it's the identity, it's the who am I? And then, it was me and the other. And every human in me versus the other will have, me first. And so we will fight other people. We are territorial. So, and humans have a violent behavior. The violent behavior, where did it come from? Where David and Goliath. David was bigger, Goliath was bigger, and we're gonna club little David, and the little David had a little bit more brain and said, listen, big guy, he tried to win intellectually over the big brute. So yes, humans are not kind to each other. Our violent behavior, and then our violent behavior towards ourselves, and it's been 200,000 years approximately that we are in this form, and then procreation, the procreation act. Go look at the Kruger Park, how lions are procreating. There is something very violent in it. The sexual act is also a little bit linked with pain, a little bit with violence, and yet it's in us. We have it in us. We have this desire. We live enclosed in us, inside of us, even though we function like a body without a head, because we never see our head. We only see the tip of our nose. But on this, we are interacting with the outside world, and so being violent and our dark side, because we now learn to repress that. It's not good to steal. It's not good to harm. So you're gonna withhold from that. And then sometimes you're gonna have a dream, and in your dream, one of the most liberating dreams was the one where I killed my own mother. So I'm telling this. She knows the story, and that was symbolically, and it was couple of months into university, me on my castle, and she tried to come up and take over, and I killed her with an arrow in the heart. So not that I didn't love her, but I realized it was a very strong dream how I symbolically made her disappear. I was lucky that I allowed myself to acknowledge that, to be honest, and to say, yes, okay, so I realized, and then I was reading books about it, and symbolicism of dreams. Absolutely. Freud and everything since then, us realizing what the human mind can do, and so being in touch with one's own dark side when one has it, and then one makes it, one transforms it. Probably in art, probably in sexual acts, probably in sports activities. Sports activities, the win-lose. I win, you lose. I mean, the rugby game is a technical game, but it is a very rough game where men are fighting with a ball according to rules, but this is it, and it's that's being human. So the human race has that. That is actually not what gives us the most suffering. What gives us the most suffering is, it's also part of suffering, but that's part of being. That's part of being of the human race. So there is suffering, yes, and then one needs to overcome it. I lost myself maybe a little bit there.
But how do you overcome it, in your experience? I know one of your things is, I still find it so impressive, this video that you showed me of Eckhart Tolle, that you were talking to him for a few minutes, or for a minute, you were literally asking him questions. But is that a route of reading up what these people's life experience are, their stories, and that helps you to deal with all of those things, or like? But
my journey was always a journey of spiritual seeker. Absolutely, absolutely. Look, one needs to be in touch with who am I, and then what am I scared of, and what are my fears, and one needs to live an examined life, and I would encourage every human being to lead an examined life. And there is no life is not challenging. Mm-hmm. No life is not challenging. And the good news is that those who suffer most actually have a chance of overcoming all that. So realizing at a young age that you're biting your nails and you cannot stop, and you speak then to a psychologist when you are 17, and he finds out with you in this discussion, because he's trained in that you actually have a fear of dying, fear of death. Where does it came from? Well, that was given to me in life, because nobody had died when at the age of 6 I realized that one day that I was immortal. But it was my biggest savior. So yes, it's unusual for a 6-year-old. It's not that unusual. One hears of a lot of parents that their children do tell them, mother, father, I don't want to die. So so you should have a very humane side to you to be able to then help your child, boy or girl, to realize that what it means to live alive and to be immortal. We are mortal. We are mortal, and it's our biggest driving force, isn't it? I mean, we're here, 26 January 2020. 55 years ago, I was in the making, and life has been. Yes, there was suffering initially, but then I examined things, and I was searching, and I was reading the religious books, and then I realized, well, that's not where I get my answers from. So, So what makes you find answers? Yeah, reading, examining, and speaking to other people. Speaking to like we said before we started. Like what Pierre Dacour says, for those that understand French, that l'être humain ne peut accéder à lui-même que dans la mesure où il entre en communication avec un autre. The human being can only access himself when he enters in communication with somebody else. And that's somebody else that then needs to understand you and feel with you and help you gain awareness, consciousness. It's the whole waking up process. That's if you read, if you listen to all those that look at Yuval Harari, how he is a fantastic global thinker, and how he explains how he got to where he was. Meditation. And meditation is always, again, analyzing or trying to listen to your thoughts. Try to be in your body. Techniques like breathing, feeling the body, listening to what you hear, seeing the sights, and then all these things together, and the thoughts. And then just accepting and looking what comes. Not changing, but being aware. And once we can focus on breathing or body, we realize that our mind gets quieter. And if we train in that, we can have moments in our day, in our very busy, active lives, where we live more consciously, where we get back to the essential me. In the essential me, there's no problem. Right now, there's absolutely no problem. Even if I would be lying somewhere with a diagnosis of a cancer or a prognosis of 6 months to live, at that moment, living there, being alive, there is no problem. Thinking in the future that I only have 6 months to live, very frightening, not good. So trying to be now in the now. And then when dark moments come up, the pain body, like what Eckhart Tolle, and you mentioned his name, explains us, is that the pain body, collective and individual. And the pain body is just the human pain. I mean, we did so many wrong things. We humans burned women, considering them as witches. We torture people, and still today. So there is pain in a human life. There is suffering. Buddha told us there is suffering. There's dukkha. And then the good news, we can come to the end of suffering.
Yeah.
How can we come to the end of suffering? That is I'm trying to be part of the solution on this planet. Become mindful, live an examined life, and then see a little bit where the world is going. We are waking up. Things have never been as good, and things have never been as bad at the same time. The trenches of Verdun or the Battle of the Bulge in the Ardennes, 80 kilometers away from where then my parents were already born, which hundreds of thousands of American and Germans killing each other in those forests in the winter. Terrible defeat for Americans and Germans. I mean, young people just killing each other not that long ago, 76 years ago. Now, 76 years ago. It's not that long. And millions of people always killed each other. We still, today we're going towards less. So it's the first time on the planet that less people die of violence than of natural death. It's the first time that more people die of old age than of infections. And it's the first time that we have more people that die of too much food rather than not enough food. So we really, sorry if I'm quoting there, that's Yuval Harari saying, I mean, we live in a good world right now. Still waking up, realizing what it means to be human, and then how fantastic. Your ancestors, my ancestors could never have met, and here we are, talking together on the African continent, in a beautiful setting, in a challenging country. It's the reason why I'm still here. 21 years down the line, I probably wouldn't have stayed here if I would have imagined my family life with children in a more protected environment, that would not have made South Africa be my first choice. Probably not.
No. That's why that's why I'm leaving. But so the interesting thing is when you were speaking now about talking to other people and connecting with other people, it's where do you meet these people to talk with? And I'm lucky, and that's because when I visited you at the hospital, it's over a month ago, one of your questions was, what's the purpose of the podcast? Why are you doing it? And I finally realized this. I've had a tough 4 weeks. I would say this middle December to middle January has been one of the toughest 4 weeks.
Oh, I'm sorry.
For years.
Yes.
Very introspective and figuring out life in a new way. And a big part came from the troubles that my wife and I were having. And a lot of my identity, my future goals, and everything was connected to her and having kids and becoming a grandfather. And there was a small period where this might not happen, so we'll have to see. So it was quite an interesting. And it made me really examine, like you were saying. And I finally found out what is the purpose. It makes me feel alive. It gives me freedom from my own thoughts and my negative patterns of thinking. It enriches me, and it just makes me feel human. And it takes away all the bullshit. When I'm awake, at some point my head makes noise, and I simplify it with there's a lot of negative thinking, and I think it's one of the things here. And I listened to Robert Downey Jr. on the Joe Rogan podcast last week. Getting out of your own way. If you want to be successful, just get out of your own way. And a podcast for me is a form of inviting a human that I don't really know to talk about topics that are very valid, that maybe without the podcast wouldn't be possible. So it's a form for me of creating a connection, because if I didn't have a podcast, I wouldn't be able to do this with you. I wouldn't have been able to visit the hospital, and that's the purpose of the podcast. And if I record everything, maybe somebody else can get it as well.
And it's very valuable. So it's very valuable. It's very new, this podcast, interesting, real communications between two humans. Yes, in one direction, and there will always be your expectation, but your interest, your openness. You're open-minded. You are open-minded, and don't worry about the negative thought patterns. All of us have it. All of us have these repetitive, negative thought patterns. You know about it. That's very good. That's the start. So you know about it, and then the good news, they are not you. Whatever we think is not us. It was somehow learned or chosen. So even if we don't know why we think the way we think, we can stop thinking like that by learning to not take things personal. This is recognizing that my thoughts are not me. You are not your thoughts. We are not our thoughts, and it took a long time, but I'm a couple of years older than you, so and then the car accidents or dealing with trauma in this country. I could not have my eyes open to a reality, and then I was able to help. So, does it take special people? We're all special people. But yes, the way life brought me to help in trauma situations. But that said, it was good, because the suffering in our life, the stories, make us become better ultimately. And ultimately, the ultimate is to lose our ego, our poor me, our self story. So you're suffering, you were born in a context, your parents gave you told you a story, your brother's stab wound to the arm, almost killed by gangsters, that he was able to fight. That now will, so far it has left a print on you, and it's normal. It didn't happen to my brothers, who live a much more protected life there, still back in Luxembourg. But it can enrich you. Many of my patients, severely injured, once they are healed, a year, 2 years down the line, say that this really transformed their life. They were broken, and now they realized also what it means to be alive. We take life for granted, and yet we have a body that a small wound in the heart, and you're gone. You're gone in 2 minutes. So life is valuable. Life is good. That premise is something that one needs to. Is it automatic? Are all human beings finding all the time that life is good? No, of course not. I heard earlier today of a human that jumped off the end of that unfinished highway in Cape Town and died. Young man, I had met the young man several times, briefly. It's deranging. How come you can commit suicide? Huh? When we can even not prevent ourselves from breathing. If I want to stop breathing very quickly, I will. The body is stronger than me, and I will then overcome. I mean, I cannot stopping to breathe. And yet, if I want, there's a lot of people that kill themselves. So it's something that we need to analyze, and people can be helped as well. So if people who have these suicide wishes should, if they can, get help. First, they should leave away all the external toxins. Stop drinking alcohol, you will stop 80% of your depression. Alcohol is a depressant, so leave away all the depressants. Leave away the negative people around you. Leave away negative people. Just and then when you have uncluttered your environment and you still find negative thoughts coming up, well, realize that it's not you. It's not me. Laugh at not a callous laugh, but a laugh. Be compassionate. Learn to be compassionate with yourself. That is important. So really loving yourself. So one of the exercises I find that makes so much sense is a mental exercise. Imagine yourself sitting in front of you. Yourself sitting in front of you. What can you tell yourself? Are you able to greet yourself lovingly? Are you able to give yourself even a hug? It's a very difficult one. Most of us are not able to really love themselves in a very detached. I don't say a detached way, loving yourself, but not I love myself because I'm so superb and better than other people. No, just I am a human being. I do my best, and for that, do your best and become quite assertive. Assertiveness is a good quality. Assertiveness is like yes. Assertiveness. Look it up if you don't know the word. But assertiveness is really determined in a point of view. Also realizing that there's your point of view and other points of view. So, but an assertive living. If you want to change, if you want to improve yourself, improve yourself. If it needs change change. If you don't change things, they will always stay the same. It's written in this book. We know it. I pointed to Life Anonymous by our common friend Freddie van Rensburg. And if you want change in your life, change. Otherwise, things will always remain the same. And to change, so analyze what works for me, and understand that it will have to be. It is a personal journey. There's no teacher in the world that will take you by the hand and make everything be fine immediately. No, life is challenging.
Yeah.
Because on the other hand, you also want to have the experience of doing it yourself.
Yeah.
If a teacher snaps with the fingers and makes you enlightened, and that's it, there you are. Are you really now enlightened? Because you can't just get there, but the aha moment can come right now, in this moment, just now, full attention. This is the best moment there has ever been. Isn't it?
I feel amazing. I feel amazing. And do you believe in mindfulness and the practice of it?
Absolutely. So that's it's fundamentally that is like so. So mindfulness, being aware of what is happening while it is happening. Inner body awareness. Really realizing that life is all the time pulling us backwards, forwards, this to do, that to do. Life is challenging. So waking up, my case, okay, my patience, what can I miss? What must I do today? What if this temperature? Should I? These type of questions. So that's all for self. Preparing a flight. But if for years you came down to living in the present moment as much as possible, life becomes much simpler. You don't worry so much of the external things. And was I helped by waking up on a ventilator after an accident? Probably yes. Happened 19 years ago. Needed surgery a couple of months later. Big change. I spoke a lot about it initially. Is it maybe the reason why I chose to become a trauma surgeon? Maybe. Did it make me a better trauma surgeon? Probably. Having been myself in an accident, having had several injuries, living with the sequela of a big chest operation and getting sometimes short of breath. But living a normal life. So life is challenging. And when now the following, Elisabeth Kübler-Ross, this psychologist who came up with the 5 stages of dying, I listened to her talk back in 1992. I was still in medical school in Brussels. She said, "Young man, you might not always get what you want in life, but you always get what you need." Ooh. How is that possible? You don't always get what you want, you get what you need. Because that implies that there would be something, God, a higher being, knowing what we need. And then that's the crucial question. Is on this planet something determining in what direction we evolve? Is that so? Because it is true, out of this chaos we came about, and we intelligent beings, and now we are examining the whole thing, and we're going, is there an evolution to history? Is there an evolution?
Because I wanted to ask you earlier when you were talking, and because one of my feelings of 2019, I've always been agnostic.
Yes.
I'm a bit like,
yes,
who knows?
Okay, yes.
Towards the end of 2019, I'm like, I don't believe maybe there is anything bigger, because that's the way that 2019 was with me. And I'm slowly moving back to this concept of synchronicity, of random occurrences that are just 1 in a billion, but 1 in a billion is fine, but then they repeat, 1 in a billion repeats itself within 5 minutes. You have three incidents. And suddenly there's been these weird things where I'm like, okay, I'm back at agnostic. So where do you lie on that spectrum?
Why would you be back at being agnostic? At least
I was back at, I went a little bit to like, there's nothing. I don't think there's anything. Like, I feel so terrible, and
Yes.
especially considering that I'm doing a lot of good work. Like, my life is dedicated to helping people
Yes,
and
yes.
their families. And
Yes.
if I look at the way I'm treating people around me and society and the way I'm getting involved, and
Yes.
I feel terrible about myself and my life, I'm like, this is just bullshit.
So why is this happening to me? Why is this happening to me when all I do is good? And is there a reason? Is there and yes, when one is in a dark phase, it's difficult to see the light sometimes. Difficult to see the light. That's why one needs to have analyzed and have a discipline into right thinking, and then one realizes that the bad parts are more easy to overcome. They will still happen. They will still happen. So, agnostic. Do we need, like Sam Harris says, do we need presence? We don't need presence of a God to realize the beauty on the planet, to realize that life is what it is, and that it is mysterious. Look up in the sky at night and wonder and awe. How evolved are we? Surely for here we look evolved, but comparing us to other beings, maybe not. Maybe so. Are they extraterrestrials? So life, this big mystery of life and being alive and living a life. Believing, well, call God infinity. Instead of saying my God, say my infinity, because that is what God is infinite power, infinite wisdom, infinite mystery. And then can we be, because God, the concept God has been mistreated, and there's a lot of fighting in my God is better than your God. But if we all speak of infinity, we can't even say my infinity is better than your infinity, because we're changing the concept, and not 3 letters that certain religions don't even want to mention, the 3 letters. So let's call God infinity. Possibly we are already having humans. We are on the stages to moving away from organized religions. Religions were important. Humans needed to have answers of what is there once this body stops. Is there something?
What's your take on that? Is there something?
Is there something? Nobody has ever come back. Is there something? I had a patient telling me an out-of-the-body experience. He wasn't dead, of course not. He was in severe shock, but he described how he was floating above himself and seeing and describing me where I was standing and where the 2 other assistant surgeons were standing, and how he said to me that he was going to survive, and how he felt me being happy, which I was, and that operation went well. Severe shock, and operation went well, so I had a good feeling, and that patient describes an out-of-the-body experience. Now, out-of-the-body doesn't mean he was dead, or he was in a tunnel, or he had passed the tunnel and came back, or so death and dying. Where is my stand today? Live now, live well, and sense the essential, your essential beingness, that the essential beingness in me is unchanged. But if you look at life, we are like in a room where the bird flies in through one window and out through the other. We don't know where it's coming from. We don't know where it's flying to. That is a little bit life, and
That's nice.
so yeah, I heard it recently. So it's a nice allegory. And so where does the bird come from? Where does it go to? Does there need to be something more? We have that in us. That is because it's that fear of the unknown, or the not being able to cope with us being told, when you die, it's forever over. So there comes then consciousness. So is our consciousness going to remain, and in what form? Or we're conscious now. Could this consciousness, is consciousness creating the material, or is the material brain creating consciousness? That is the big question, where scientists today, some say no, we're only conscious because we have a functioning brain. No more blood to the brain, couple of minutes, game over. And yes, there's brain dead. We have patients that are brain dead. The body is alive. Well, the heart is beating, but I switch off the ventilator, the heart will stop, because they will not breathe. The brain is so dead that it doesn't have any control over the body. So that's the notion of brain dead. And these are the organ donors, potential organ donors, especially after trauma. So, and then is consciousness, is there something more to it? Sometimes you see, what do you do when you see these prodigy children who at the age of 9 or 10 open their mouth and they sound like the biggest opera singer. They sound like Maria Callas. They are 9 or 10 years old or 11 years old. They have never studied, and there seems to be something coming through this human being that now sings like Maria Callas, has not studied it, is not always coming from such a family, and so genetic or something else. Is there something else that we still have to tap into? Interesting. We don't know. We're surrounded here by Wi-Fi. We're surrounded by waves, and we don't see those things. So we in this human form, we perceive a very limited spectrum of a material world, and it doesn't say that there's nothing between you and me. There's plenty of atoms. We don't see that.
Yeah.
So we must recognize that we don't know, but we must also accept that we are in this body right now, this consciousness. There is consciousness, a notion that we can't point to it. Consciousness is possibly the ultimate reality of everything that is consciousness, like the universe. The universe is, and if we say Big Bang, what was before the Big Bang, we can't conceive that. It's not conceivable. And if we say it's an expanding universe, what is behind the universe? We can't. But thinking about it is so magical, isn't it?
Yeah.
Trying to imagine if this universe is expanding and so big, and we are just so small here, and then or parallel universes. Is it possible that there is parallel universes, that this is happening in one reality, but fascinating. Not for my life, not for now. I accept fully that I have a limitation, a limited brain, and I will be happy to just speak my four languages, do trauma and healing to the best of my abilities, and remain open. But healing is about being in balance, and then aging according to the push and pull factors of life. We are aging, so let's then eat healthy, drink, sleep healthy, avoid toxins, and then with that we're going to age, and one day, for hopefully a benign reason, is our heart going to stop, and then we're going to be a dead body, and then it will not function anymore. We should by now organize it such that we would burn and then be returning into nature. If we die young, we should give away our organs, and we should have been part of the solution, part of, maybe ultimately part of love. Would it be that? Is the big principle that holds everything together, is that, can one call it love? Is it possible that everything that makes this, that is that infinity, isn't it? It's so God, or infinity, infinite organizing power, infinite beauty, infinite harmony, and infinite chaos. So maybe everything is true. Imagine everything is true. Chaos and order. There needs to be both, order and chaos. On your podcast here with Yaku, he went quite far, and he's a good thinker. Me, not at all, and I would never. This is just my own sort of rambling in where this discussion brings us. But what do you think about it? Order and chaos. Everything is true.
Yeah.
Everything is ultimately true.
Yeah, and I think a big part of my discussions are regarding humans and the way we live and work and operate, and we have weird patterns. We have some genetics within us, and it's weird how there's this desire to understand within some of us, but sometimes even understanding doesn't make it easier, you know. And I think something that most humans suffer from, and I think I have it too, is the struggling to give time. You know, just be patient. You know, life is difficult now, but next year you might be in a different place. What you feel right now is not going to be forever.
Because it's not you. This feeling, this everything is generated by an environment. Remember, it does take time to realize that things do not need time. When we understand ultimately that everything is happening now the way it is, one needs to realize that. Now, to get there and to realize that it took time, but then it actually doesn't take time to step out of that.
Yeah.
So don't step out of this constant searching, yes, questioning, yes. Well, if I say yes, questioning, focus on self, focus on breathing, and live life through these actions. Have your values, doing good, no resistance, no attachment, no judgment. Enlightenment. Stop judging yourself. Don't resist what is happening, and not too much attached to outcome. So, and more people tell us that the more we let go of the attachment and of the attachment to outcome, the more easy we will live. So as well, what we said before, these trauma death that happened, I did my best. I wasn't the bullet or the multiple bullets or the driving and hitting an object at 100 kilometers an hour. That wasn't me. I now come in. So don't take things personal. Always do your best.
I think I have a million more questions that I could ask you, but I see we're on 140 minutes.
140?
No,
that would be 2 hours and 20 minutes.
We're on 100 minutes. We're on 1 hour 40 minutes.
1 hour 40 minutes, yes.
Which I think it's a good time.
It's a good time to say goodbye.
to wrap things up. I have a lot of questions. I'm sure there's some people that would have more questions, like maybe more plain questions, like what's a variety of trauma that you've done. Your presentation is fascinating, that we went through. The one question that's in my head that you can maybe ask next time is, saving someone's life.
Yes.
Does that give you enough energy to love yourself and to give you strength for your life?
It is very rewarding when the whole system fell in place beautifully and when all efforts came together and that the patient reacts as he or she should. That is rewarding.
Okay.
Absolutely.
But there's and I think the questions that we read in the beginning, they all somehow got answered in some shape or form. I think.
Otherwise, we'll come back.
I would love to have you back. I always say to people, it's impossible to really have a conversation. 2 hours is a long time to listen to two people talk.
Yes.
But for the two people talking and trying to understand each other, it's nothing.
Absolutely.
And I would love to have you back if you have time. And there's so many questions and angles and things that we can, and I've loved it.
And I appreciate very much that I'm able to share, because indeed I do find that I have an interesting life. I work towards that, and many aspects of it, but also then not being shy of making choices like working in Somalia, remote site surgery, in a dark place. That is really a dark place. I was a little bit shell-shocked after that. I thought often about suicide bombers, even though I was now in the rather safe South Africa. But so I went into dark places of the world, but it made me even more aware. I will not go back there. I will now focus here in private healthcare, being part of a system. Yeah, but it's an interesting life. Yes, I love my life. I love it, but I worked hard towards it, and when decisions were to be made, I didn't shy away from difficult choices. Was it, why do we do these choices? We can approach that next time.
Thank you. And hopefully now there's a few contact details that's popping up on the video. If you're listening to this, please just look at the description. I'll put Denis' contact details, links and all of that. So if you also want to make sure he's a legitimate trauma surgeon, you're welcome to go look at that. And if you wanted to contact Denis for anything,
yes, absolutely,
please do so.
Absolutely.
I'm going to say goodbye to everyone, but me and you're going to continue talking.
Yes.
Outside.
Super. Thank you.
Thank you so much.
Thanks to the listener. Bye-bye.
Ski medieval is this door. Uitgeschoten on blok.
That's a mountain.